Hi, I'm Dr. Russell Faust, Medical Director for Oakland County. We wanted to share some facts about viruses, about this coronavirus specifically, and about the Delta variant. It's important to know that all viruses constantly change through mutation, and new variants of a virus are expected to occur. The SARS-CoV-2 virus is no different and has mutated many times since it first emerged early last year. This Delta variant is a naturally occurring mutation of the SARS-CoV-2 virus, the virus that causes COVID-19. Delta is currently the predominant strain of the virus in the United States. The Delta variant is highly contagious, more than twice as contagious as previous variants. Unvaccinated people remain our greatest concern. The greatest risk of transmission is among unvaccinated people, who are much more likely to become infected with this virus and therefore to transmit it to others. Unvaccinated people infected with the Delta variant are more likely to be hospitalized than patients infected with the previous strains. In fact, they are 25 times more likely to require hospitalization and 25 times greater risk of death from COVID infection. Now, even fully vaccinated people can become infected with the Delta variant. This is called a breakthrough infection, and even fully vaccinated people can spread the virus to others from a breakthrough infection. However, the amount of virus produced by Delta breakthrough infections is much lower, and viral levels decrease faster than the amount of virus in unvaccinated people. This means fully vaccinated people are less infectious and for less time than unvaccinated people. Breakthrough infections also typically result in milder disease. Now remember, every active infection produces more mutations, more variants. The best way to slow or stop the emergence of new variants is to reduce the spread of infection. We can achieve this through vaccines, masking, testing, and quarantine. Data shows that COVID-19 vaccines are extremely effective in protecting fully vaccinated people from catching and spreading this virus, including the Delta variant, and protects them against severe disease with COVID-19 and hospitalization and death. As of August 23rd, Oakland County is at 71.8% COVID-19 vaccination cover for residents 16 years and older who have received at least their first dose. This is great progress, thank you. However, Oakland County is now an area of high community transmission, according to the Centers for Disease Control, and risk level D, according to Michigan Department of Health and Human Services. So many factors are converging to increase COVID infections. Our kids are returning to school and sports. More and more people are returning to in-person workplace. International travel is opening up again. Students from other states and even other countries are returning to our colleges and universities, and we're all headed indoors again as cold weather approaches. All this means that vaccination efforts are more important now than ever. COVID-19 vaccine clinics are available at sites throughout the county and at both Pontiac and Southfield Health Center locations. Oakland County Health Division will continue to focus on specific demographic groups and local communities where vaccination rates are lower. Go to oaklandcountyvaccine.com to locate a clinic near you. I urge you to get vaccinated if you haven't already, and encourage you and your family and friends to do the same. One by one, vaccination will allow us to get through this surge of the Delta variant and slow the emergence of additional variants by limiting the opportunities for the virus to spread and change. Everyone should wear a mask indoors in public, even those who are fully vaccinated. This will maximize protection against the Delta variant and prevent possibly spreading it to others. Avoid crowds and poorly ventilated spaces, especially if you're unvaccinated. You should still watch out for symptoms of COVID-19, especially if you've been around someone who's sick. If you have symptoms of COVID-19, you should get tested and stay home and away from others. If your test is positive, isolate at home for 10 days. If you are vaccinated and have had close contact with someone who is COVID-19, you should get tested 3 to 5 days after your exposure, even if you don't have symptoms. Remember, reputable vaccine information includes websites that belong to scientific and medical organizations, academic institutions, public health, and professional medical groups. Information on trusted, credible websites is researched, written, and approved by subject matter experts, including physicians, scientists, epidemiologists, and is peer-reviewed by independent experts in the field who accept it as valid. Your best resource for up-to-date information on COVID-19 is cdc.gov. Thanks for your help in keeping our community safe.